On the occasion of World Ovarian Cancer Day, let's talk about ovarian cancer, the silent killer. It's an honor to introduce you with the esteemed doctors present for today's discussion. Dr. Suresh Advani is an eminent oncologist. He is a medical director at Jaslok Hospital and Research Center, and he is associated with many more hospitals. He is a president of Helping Hand Organization. He is a recipient of Padma Bhushan, Padma Shri, and also got awarded for lifetime achievement in oncology by Harvard Medical International. He is a great source of inspiration to young doctors and all of us. Dr. Haresh Vagashya is a consultant laparoscopy gynecologist trained from Grant Medical College, Mumbai, with specialization in laparoscopy gynecologist and certification in office heteroscopy from University of Bari, Italy. He has to his credit many awards in the field of laparoscopy gynecology and heteroscopy. I welcome both of you. Dr. Prashant Nayati is an oncosurgeon. He is a consultant gynecologist and robotic oncosurgeon. He's done his fellowship in gynecology oncosurgery at Tata Memorial Cancer Center and IGCS fellowship from Mayo Clinic, Rochester, and he's done his robotic training from Sunnyvale, USA. Currently, he is associated with SL Rahija Hospital, Shushruth Hospital, and Jaslok Hospital. Welcome, Dr. Prashant.
Thank you.
And we have with us Monica Agrawal and Savita Mahajan. Both of them have fought ovarian cancer bravely. They are here with us today to share their story and experience. About myself, I'm Rashmi Mehra Kumar and I was diagnosed by ovarian cancer in the month of January 2016. I believe positivity changes life, and with this motto, I fought cancer. In fact, I believe cancer is curable. So with this thought, let's begin our today's discussion. What is cancer? This big fat C in our life. In simple, plain words, cancer is nothing which comes from outside in our body. It's not a foreign element. It is a cell, a normal cell, which starts decaying and it grows out of proportion in any part of our body. So according to me, this is what cancer is. But here we have experts who can help us understand cancer and ovarian cancer better. So Dr. Advani, my first question to you is, sir, can you please explain what exactly cancer is and throw some light on ovarian cancer?
See, normally in our life, and all our body cells, whether they are in the ovary, breast, intestine, skin, all of them are well regulated. The meaning of well regulated is that they grow to the extent they are necessary. And once the necessity is achieved, they stop growing.
Okay.
So this is what we call it auto-regulation. Every cell is auto-regulated. When this auto-regulation fails, the cells have no control. And those cells, they multiply. And once they multiply, they go on eroding the surrounding cells. They also erode the vessels, and therefore they get into the circulation and go all over the body. The same thing probably happens in ovarian carcinoma, that the cells grow from ovary. Initially they are inside the ovary, which ovary is capsulated, so they are inside, they grow, and then they multiply, and then they travel to the surface of the ovary. That is what we call it second stage. And once they come on the surface, they go into the surrounding tissues. And that's what we call it stage 3 in the omentum. And then they enter the circulation, they can go to the liver, lung and bones, we call it stage 4. So basically, if you look at it, it is a loss of regulatory control on the normal cells, which ultimately leads to the development of the cancer.
Thank you, Dr. Advani. So this is how he's explained us what is cancer. Dr. Harish, can you please let us know what are the common screening tests a woman needs to do, and is it any age appropriate, and what are the common symptoms which should not be ignored?
Okay, coming to common symptoms and the screening test. Now, first of all, I would like to tell you what is screening test. Screening tests are some laboratory tests that is being done on patients, wherein you can diagnose the cancer happening into them earlier than actually the symptoms of the disease occur. So you can prevent these patients going into an advanced cancer stage. So there are certain various screening tests for various cancers. For ovarian cancers, we have from beginning we have transvaginal sonography. As she said that sonography was her savior. So when a lady has some symptoms like say abdominal pain or bloating or menstrual irregularity, then they have to go to a gynecologist, not treat themselves or ask the friends and take no treatment at all, and then the cancer advances. So before that, you go to a gynecologist, get your examination done, and go through a transvaginal sonography and blood test called CA-125. Now these are the common screening that is done. Now to addition to that, recently what has come is something called as HE4. Okay, that is human epididymal 4.
Okay.
And by calculating the various patients' age and the levels of this thing, we calculate risk of ovarian malignancy algorithm, that is ROMA.
Okay.
So depending upon the test, you can actually predict whether this patient has tendency to develop cancer or no.
Okay. Okay. So this is age appropriate. So
Yes.
is there that you have to at particular age go and get your test done?
Yes, not
or
every person needs to do this test. The patients who have family history positive, like the patient's primary relative or secondary relative are suffering from the breast cancer or ovarian cancer, which is like reproductive organ cancer, then those patients, the relative of these patients should do screening test earlier, say the age of about 25 to 35 years. However, for the general population, the risk is not much. So they can start the screening test at about 40-45.
Okay, okay. So I would like to add that what were my common symptoms which made me go and visit my gynecologist, because for me, I went and got myself diagnosed by cancer. I had the same what common symptoms were told, that I used to feel very heavy. Even before eating, I used to feel that, I've eaten something very heavy. Other thing I used to have was common, which people think it is very common to have a back pain. We feel that it is, normal to have back pain, but it was sustaining for a longer period of time. And yes, I have a irregular cycle. So these were the three common symptoms which can normally go without, going diagnosing towards cancer. It is not necessary that it is, you have any of these symptoms that means you have cancer. But these were my common symptoms which told me, or rather my body told me that I need to go and see a gynecologist, and then the whole screening and sonography and everything started. So yes, please do not ignore any common symptoms if it sustained for a longer period of time. I would like to ask Monica. Monica, can you please let us know what were your common symptoms and how did you get diagnosed?
See, I was actually suffering from severe menstrual pain, and I was diagnosed with endometriosis. But over a period of time, the pain increased, the intensity of pain increased, and also the irregular periods and spotting. Irregular spotting was also there. But then I was visiting my gynecologist on a regular basis, but these were seen as symptoms of endometriosis. And then I was advised a laparoscopic surgery where they said they will remove the cyst. So I underwent a laparoscopic surgery where they removed the cysts and all. Then post the surgery, I was on a regular checkup by the gynecologist. I was given some hormonal treatment also. But in the ultrasound, it came that the cyst has recurred and it is increasing in size. And then it became so big, it was almost 10 centimeter. And then I was advised that, okay, now we need to do a complete hysterectomy, remove the ovaries and all through laparoscopy. So I actually, जो भी मेरे gynecologist ने बताया, so I agreed to that and I underwent the surgery. During the surgery, the surgeon realized that this was not a cyst, it was a tumor, and there they called an oncosurgeon. So an oncosurgeon performed my surgery. He removed the entire, the complete surgery was done, and that was it was sent for biopsy.
Okay.
So the biopsy revealed that it was a malignant cyst, a tumor. And after that, then I consulted Dr. Advani, and my chemotherapy started, 6 cycles of chemotherapy, and now it's been over 3 years, and I'm absolutely fine.
Congratulations, that's good. You're absolutely out of it. So Dr. Harish, as Monica said, that during the surgery they realized that it was a tumor and not a cyst. So if the cyst or if the mass is not malignant, then what is the course of treatment?
Generally, a benign cyst, which is very common in reproductive age. We see multiple types of cysts that occur in the reproductive age, and it is treated with laparoscopy most of the time now, because it has its own advantages over the open surgery. However, there is a very thin line between the benign and malignancy before going into the surgery. And as a wise surgeon, I think a person who is operating should always weigh the situation and then only starts, taking the decision of doing it laparoscopic. Now, there are patients who have had a single solitary cyst, which is looking simple on sonography, and other blood parameters like HE4 and CA125 is normal. I would advise to go for laparoscopy. However, during laparoscopy, I have to make an inspectory finding that if this tumor or a cyst is having any other connections to anything, I should not jump to directly opening up the cyst, otherwise the stage of the disease will increase if it is malignancy. So any wise surgeon would take these steps, and in benign cyst, generally removal of cyst and preservation of ovary is suggested. But if you have malignancy or you have anything which suggests, so you have to keep 2-3 things ready. That is something called as frozen section. So wherein you have cyst in your hand, you have to do content dissection. That is, you are not supposed to spread the tumor into the abdominal cavity. You use something called as endo bag, within which the dissection is done. However, these particular things are not sure shot, but it helps the patient who is not yet completed their fertility, and the preservation is more important than removal.
Sure. Thank you, Dr. Harish. Dr. Advani, what are the current challenges in detection and management of ovarian cancer in our country? And what are the different line of treatment which you suggest for a woman who comes with such kind of a problem? If you can just help us to understand it.
I think basically because the ovary is situated in the pelvis, the symptoms come much late.
Okay.
And therefore, early diagnosis is difficult. The best way to diagnose early is to be conscious about that, aware about it. Any little gynec disturbances, any little pain, particularly in the age group of 40s and 50s, one should at least get a simple test like sonography done to rule it out, the ovarian problem. So I think that's the only way that you can really diagnose the disease early. And majority of our patients which we diagnose early, they are diagnosed accidentally. They go for some little pain in the abdomen, and at ultrasound they find that there is ovarian cyst or ovarian tumor. So if you look at it, it's a by chance. But I think important thing is to be aware about it, and at the level of any abdominal disturbances, one should at least get the ultrasound done. And I must say, I'm very happy that in India, the ultrasound has rapidly expanded. Even in the most small village, ultrasound is available. So gynecologists are expert in that also. So luckily, this has allowed us to diagnose the disease early and earlier. Now, as far as the treatment is concerned, mainly there are 2 types of the treatment. One is surgery, and the second one is the chemotherapy. And I think all of us like that the surgery should be the first line of treatment, because when you remove the bulk of the disease, if there are residual few cells, it's easy to eliminate them with the chemotherapy. So the most important, the part on which we rely as far as the cure is concerned, is the oncosurgeon. Oncosurgeon is the pivotal person who plays a major role in ultimate outcome of the disease. So we have a tremendous sort of confidence in the gynec oncosurgeon, who can really make the life of the patient as well as us also easy.
Thank you, Dr. Advani. So, Dr. Prashant, right, you are here. We would like to know more about surgery. Does every patient need a surgery, and what is the recovery process or path after the surgery?
Sure. Thank you so much, sir, for giving us the pivotal this thing. Definitely we will keep up the faith. Main thing is we divide this into two parts. The surgery is divided either primary surgery, as sir told, the first surgery, and second part is the interval cytoreductive surgery. So it depends on the patient to patient, the general condition, the imaging findings, her clinical condition, how all these things, by which we decide whether this patient has to go by a primary surgery, or then we have chemotherapy, 3 cycles of chemotherapy, and then do a debulking surgery. So that is a crucial call, because we need to finalize prior to surgery whether I will be going to do a very good fair job for the patient. If I am not going to do a fair job, then I will prefer help of sir, by which we can give them chemotherapy debulk, that is known as cytoreduction, and then after neoadjuvant 3 cycles of chemotherapy we do the surgery. Now the surgical part, it involves removal of all the organs which are associated, that is the uterus, the tubes, the ovaries, the pelvic lymph node, the paraaortic lymph nodes, the appendix, the omentum, and multiple organs which are to be involved by the tumor, like liver, subdiaphragmatic areas, peritoneal aspects, everything. So this is a supramajor radical surgery, and this surgery usually takes around 4 to 6 to 8 hours, depends on the extent and how. And the course of recovery depends on the patient's fitness and the determination, plus how she has her general conditions and all the things. So this roughly takes around 4 to 8 days in average for the recovery.
For the recovery, 4 to 8 days.
4 to 8 days.
Okay.
And then the long-term recovery, it takes roughly around 2 to 3 weeks.
2 to 3 weeks. Okay. Thank you, Dr. Prashant. Dr. Advani, when it comes to chemotherapy, can you just explain us what is the protocol for a chemotherapy, and what are the side effects one can expect when she is going for a chemotherapy?
I think the word chemotherapy frightens everybody, and I think this is what happened. All patients who come to us, they are frightened, and that's a thing which is, because they have heard from so many people around here that side effects and all, some of them which are imaginary also. So I think it's very important to realize that today, the whole approach in terms of controlling the disease rests upon one, as we have said, that surgery, and then the microscopic disease, which we cannot see, has to be eliminated by the drugs which reach everywhere in our body. So chemotherapy is nothing but the drugs. Basically, these are the drugs which are given. They have to some extent selective action on the tumor cells, so they kill them, but also they have the effect on the normal cells also, and therefore you get the side effects. But the normal cells are more smart, and therefore they recover much faster, and that's how we deliver the adequate chemotherapy to eliminate the tumor cells and allow the normal cells to regrow. And that's the reason why the chemotherapy is given in interval. We give every 21 days or every 15 days. Why? Because that in between time we allow the normal cells to regrow. So basically the chemotherapy has some side effects, but all of them are reversible. So the most important thing to remember is that the chemotherapy is very safe in the experienced hand, and one can go through it with reasonable good ease nowadays, where we are talking about the better therapy, in the sense that today, previously I remember 30, 40 years ago, people used to vomit a lot. Today, hardly any more vomiting. Previously, people used to have the low WBC count. We used to tell them not to go out and all. Today, we have the drugs which can stimulate the blood count, and therefore they don't have the problem with a low count. They may feel a little weak for a few days and they have hair loss, but all these are reversible. So I think we take the advantage that whatever side effects we get with the chemotherapy, they are reversible, and that's where we have to make sure that the patient understands this.
Yes.
If they understand, then it's very easy for them to accept that yes, it's reversible and we'll get it back. And that's where I think the counseling by the patients to the new patient is important.
Very rightly said by Dr. Advani. I would like to add, Dr. Advani had exactly told me when I was going for my chemotherapy that please do not listen to everyone or anyone who's trying to say that there will be a side effect to chemotherapy. He said it is all imaginary. Right now he also said आधी चीज़ें हम लोग सोच के अपने मन में बना लेते हैं कीमोथेरेपी के लिए, और आधी एक्चुअली अगर होती है, if we face it strongly, then we will definitely have very less side effect. In fact, Dr. Advani, if you remember, I had severe neuropathy problem in my left side of hand and arm and leg, but he said, do not sit, go back, get your body back in action, and that's what I did. Even after having a side effect of chemotherapy as a neuropathy, I started using my hands and legs, I started walking, I started running, and post that actually I'm glad to say that I ran 4 marathon, in last 6 months I've run marathon. So it actually depends upon each individual if he or she wants the chemotherapy side effect to happen or not. With that, I would like to request Savita ji to explain and throw some light on her story and her experience.
Mine was low grade fever. It was about it was continuous fever. मैंने बहुत एंटीबायोटिक्स लिया और डॉक्टर्स को दिखाया, बट फीवर जा ही नहीं रहा था. अभी दिल्ली जाना था, फंक्शन है कि चलो फीवर चला जाएगा, नहीं गया. वहाँ डांस किया सिस्टर के फंक्शन में, तो मेरे पेट में नीचे दर्द होने लगा, और शुरू से ही मेरे को पीछे पेन होता था, पीरियोडिकल पेन होता था पीछे अंदर. तो मुझे लगा ऐसे ही कुछ होगा, पेन हो रहा है, तो कभी लगा पाइल्स तो नहीं है, कुछ तो नहीं है, ऐसे डाउट हुआ. बट वो पेन, डॉक्टर कह रहे ऐसा कुछ नहीं है. और मेरे पीरियड्स भी ना धीरे धीरे इरेगुलर हो गए, धीरे धीरे कम हो गए, इरेगुलर हो गए, और वो फीवर मेरा जा नहीं रहा था. और मेरा जो ट्यूमर था अंदर, मेरे ब्लैडर को प्रेस कर रहा था, और मैं बार बार यूरिन जाती थी. और मैं चली गई यूरोलॉजिस्ट के पास, डॉक्टर शरद सागरे. उन्होंने मुझे चेक किया, ही इज़ वेरी काइंड और वेरी इंटेलिजेंट. उन्होंने चेक किया और ये बताया कि आपको ना सोनोग्राफी करानी पड़ेगी. मैंने बहुत सारी यूरिन इन्फेक्शन की दवाइयाँ खाई, इस डॉक्टर के उस डॉक्टर के, मुझे लगा यूरिन इन्फेक्शन ही है मुझे. सोनोग्राफी में आया कि मुझे कैंसर है. डॉक्टर किरण कोयले उन्होंने फिर मुझे फीवर जा ही नहीं रहा था, फिर मुझे एडमिट कराना पड़ा. सोनोग्राफी में शुरू में अल्सर ही आया था, मतलब अल्सर ही आया था, कैंसर तो बाद में एडमिट किया. और उसके बाद मेरे को बहुत सारी एंटीबायोटिक चढ़ाई गई कि ये होगा वो होगा, और वो फीवर मेरा जा नहीं रहा था. फिर मेरा ऑपरेशन अभी डिसाइड हो गया था, बट डॉक्टर तंदावकर हैं, डॉक्टर तंदावकर ने बताया मुझे कि
डॉक्टर हेमंत
तंदावकर ने बोला कि ऑपरेशन नहीं करना है, बायोप्सी करो, इनको लो ग्रेड फीवर है एंड आई डाउट कि कैंसर हो सकता है. फिर मेरा बायोप्सी हुआ हिंदुजा में, डॉक्टर कुलकर्णी ने किया, और उसका 2 जगह उन्होंने भेजा बायोप्सी का सैंपल, और फिर मुझे कैंसर आया. और मुझे बताने के लिए, फैमिली को बताने के लिए बड़े अच्छे से मेरी फैमिली को बुलाया गया, बड़े धीरे से बताया गया कैंसर है. बट मुझे लगा है तो है, आई वॉज ए फाइटर. मुझे बहुत विल पावर थी, बहुत कॉन्फिडेंस था कि मेरे को ठीक होना है. और अगर आपके पास विल पावर है, कॉन्फिडेंस है, और आपकी फैमिली आपके सपोर्ट में खड़ी है, तो आप ठीक हो ही जाओगे. और मुझे ऐसे भी लगता था सम सुप्रीम पावर इज देयर हु इज वाचिंग, हु इज गाइडिंग मी टू गो टू राइट पीपल. मेरा एक सर्कल बन गया। मैं अच्छे लोगों, अच्छे डॉक्टर अडवाणी, डॉक्टर तमगांवकर, डॉक्टर गणेश नागराजन, मेरी फैमिली, डॉक्टर हर्ष महाजन है दिल्ली में, सारी फैमिली मेरे साथ थी। आधी फैमिली को मैंने बताया नहीं, रिलेटिव्स को आधों को ही बताया। तो मेरा मतलब मुझे बड़ा कॉन्फिडेंस था कि मेरा जब भी MRI या पेट स्कैन होता था, भैया मेरे हर्ष महाजन, मेरा भाई दीपक है, मतलब सबको उधर पहले जाता था, बाद में मुझे बताया जाता था। तो इस कॉन्फिडेंस के साथ मेरे बहुत सारे 5 कोर्स ऑफ कीमो हुए। मुझे एक बार कैंसर हुआ, मेरा बहुत ज़्यादा बढ़ गया था, 3rd स्टेज था, 3rd एंड 4th स्टेज के बीच में था मेरा कैंसर, और 2 kg का ट्यूमर निकला था अंदर। 16 जार्स में मेरे बॉडी पार्ट्स उन्होंने निकाल के रखे थे और एक ट्रे में, कि फैमिली रोने लगी मेरे देख के, बट मुझे असर नहीं हुआ। मैंने फाइट किया, मेरे कीमोथेरेपी कराने में सीधा आती थी, मैंने कभी मना नहीं किया कीमो के लिए कि मुझे करना है। ग्रेवियोला सोर्स, एंटी कैंसर फूड और कैरेट जूस, ये सब मैंने साथ साथ लिया। कच्ची हल्दी, जो भी कोई मुझे कहता था एंटी कैंसर, वो मैंने लिया और कॉन्फिडेंस लूज नहीं किया। और जब जब लूज होता था, मुझे एक ड्रीम आता था, मेरे फादर आते थे, कहते थे कुछ नहीं होगा, कुछ नहीं होगा। तो एक सुपर पावर थी जो मेरे साथ थी। फिर मेरा कैंसर रीओकर भी हो गया था, क्योंकि फर्स्ट टाइम मेरा कैंसर बहुत ज़्यादा था, 2 kg का ट्यूमर मेरे अंदर से निकला था और 9 आवर्स की सर्जरी थी, 9 घंटे की सर्जरी। एक बार ऑपरेशन होने के बाद 9 आवर्स सर्जरी, मुझे कैंसर दोबारा आ गया जब मेरा पेट स्कैन हुआ कीमो के बाद। तो सारी फैमिली उदास होगी, पर मुझे नहीं बताया गया। मेरी बेटी ने अभी MBBS किया है, मेरे साथ ही मेरे हस्बैंड, मेरा बेटा, मेरे बेटे ने ही देख देख के नेट पे मेरे स्पेसिमेंस भिजवाए थे बाहर टेस्ट के लिए। फिर हमें लकीली डॉक्टर अडवाणी का, डॉक्टर तंदावकर ने बताया कि अभी आप कीमो चेंज करो, जहाँ से पहले कीमो कराया था हम वहाँ सेटिस्फाइड नहीं थे, हमने फिर इनके पास आए कीमो के लिए। और इन्होंने कीमो के जो कोर्सेज किए वो ये बताएंगे आपको कि मेरा कैंसर कैसे चला गया ड्रामेटिकली, मैजिकली। मैं आज बहुत ठीक हूँ। और ऑपरेशन जो सेकंड टाइम हुआ था 8 आवर्स का, वो भी था, पर मेरे सारे सेल्स डेड सेल ऐसे थे और आई एम वेरी हेल्दी नाउ। मैं अभी बड़ा हेल्दी फील करती हूँ और पूरी फैमिली मेरे साथ थी और विल पावर थी, कॉन्फिडेंस था, मुझे तो ठीक होना ही होना है। मेरी फैमिली में दिल्ली से डॉक्टर हर्ष महाजन, दीपक, मेरी मम्मी सबसे ज़्यादा चिंता में हो गई थी, डेली फ़ोन करती थी। और जब मम्मी का फ़ोन आता था मैं बड़ा ज़ोर से बोलती थी कि मम्मी को ये लगे कि मुझे कुछ नहीं है, क्योंकि मेरी माँ तो बूढ़ी है, वो चिंता हो गई कि मेरी बेटी को क्या हो गया। पर जब भी किसी का फ़ोन आता, मेरी सिस्टर का, ब्रदर का, यहाँ दिल्ली से, जो बहुत चिंता में थे सब, तो मैं बड़ी ज़ोर से ऊंची आवाज़ करके बोलती थी, चाहे मेरे को कितनी कमजोरी थी, कितना दर्द था, मुझे था यहाँ मेरे को ज़ोर से बोलना है। आप बताएंगे?
So, डॉक्टर अडवाणी, आप बताएंगे सविता महाजन जी का जो वो बोल रही हैं सेकेंड रिकरेंस में।
जब भी ये बीमारी में हम लोग तो कोशिश करते हैं कि सेकंड टाइम नहीं आए, वो हम लोगों का मेन एम होता है कि सेकंड टाइम बीमारी नहीं आए, क्योंकि सेकंड टाइम आता है तो सब लोग, डॉक्टर लोग भी घबरा जाते हैं। तो अभी जब इनको सेकंड टाइम हो गया बाय चांस, तो ऑब्वियसली उनके घर वाले सब लोग परेशान थे और हम लोग भी इधर उधर सब देखकर जो भी अपना ट्रीटमेंट हम लोग नॉर्मली देते हैं वो तो दिया, पर ऐसा भी सोचा कि नया कुछ करें। और उसके लिए आजकल हम लोग जीनोम एनालिसिस करते हैं, जीन की एनालाइज करते हैं, और वो जीनोम एनालिसिस से हम लोगों को कभी कभी कुछ इशारा मिल जाता है कि क्यों नहीं नया दवाई ट्राई किया जाए। तो आपके ट्यूमर के लिए भी वो स्विट्ज़रलैंड से जब भी लेबॉरेटरी से डिस्कस किया तो हम लोगों को लगा कि एक नया दवाई जिसको आजकल हम लोग इम्यूनोथेरेपी बोलते हैं, कीट्रोडा, वो शायद इसमें बहुत यूज़फुल होएगा। तो लकीली आप लोगों ने ये दवाई तभी इंडिया में अवेलेबल नहीं थी, तो अरेंज किया, बाहर से दवाई आई, आपको दिया गया, उससे ट्यूमर बहुत श्रिंक हो गया। पहले तो ट्यूमर इतना बड़ा था कि सर्जरी नहीं हो सकता था, रिपीट सर्जरी, पर जब ये छोटा हो गया तो फिर हम लोगों ने सर्जन डॉक्टर हेमंत टोनगांवकर के साथ डिस्कस किया और सेकंड टाइम सर्जरी किया, और उसके बाद थोड़ा बहुत कीमोथेरेपी से पूरा बीमारी निकल गया। और आज 2 बरस हो गए आपको?
हाँ, और CA टेस्ट है 6।
Yes, CA 125 is 6. She knows that. 1 year ago she showed me. 1 year ago also 6. Now also 6.
Very
Yeah.
good, very
Yeah.
good,
And I am
Savita ji. Very nice, Dr. Advani. So this is ultimately यही बताया जा रहा है कि you don't have to, feel weak. You have to stand tall, stand united, and fight this disease. This disease is definitely curable. One last question, Dr. Prashant. I would like to know if you can throw some light on BRCA1 and BRCA2 gene.
Actually, BRCA1 and 2, and there are a couple of other genomic family groups in which there is nowadays in certain study जो हम बोलते हैं कि family linked. So not every first basic whatever I want to tell is don't consider कि ये cancer is family. एक family में cancer नहीं spread होता है. Only certain specific cancers are there that can, not compulsorily, but that can run in families, and BRCA and couple of other Lynch syndromes and these syndromes are there which can be transmitted from mother to daughter. So these BRCA testing and nowadays ये आजकल बहुत cheaply Indian version भी available है. You get US testings, those they are a bit costly like 2 lakh or something like that. But this can be done nowadays in India also, और उसका cost effectivity is down to like 20,000 rupees. But that too you have to like testing करना है ज़रूरी नहीं है. You have to do a genetic counseling first. सबसे main यानी आपको कैंसर हो गया इसका मतलब ये नहीं है कि you have to run for all this test. You have to do a genetic counseling जिसमें फैमिली ट्री किया जाता है आपके फैमिली में किसको कैंसर था कुछ था ये अकॉर्डिंग टू दैट वी विल रन द ग्रुप ऑफ टेस्ट्स ऑन यू और फिर आपका रिस्क कैटेगराइजेशन और नॉट आपका बट आपके बच्चों का भी रिस्क कैटेगराइजेशन वो BRCA टेस्टिंग से होगा एंड देन वी विल गिव यू व्हाट प्रिवेंटिव एस्पेक्ट्स कैन बी डन फॉर दैट.
Okay, thank you, Dr. Prashant, for throwing some light. Dear friends, so let cancer be only a chapter in your life, not the complete story. With this thought, I would ask Monica to explain her final, what gave her the strength and how her family and friends supported her in her journey.
या मुझे लगता है फैमिली सपोर्ट बहुत क्रूशियल है. लाइक मेरे केस में माय हस्बैंड वाज ऑलवेज देयर विद मी विद अ वेरी वेरी पॉजिटिव एटीट्यूड. My mother she did not leave me even for a single day when I was going through chemotherapy. घर में जो एक माहौल था बहुत पॉजिटिव था, बहुत हमेशा ये था कि सब कुछ ठीक होगा. तो अपने अंदर भी एक फाइटिंग स्पिरिट होना बहुत ज़रूरी है, बट डेफिनेटली फैमिली एंड फ्रेंड्स का सपोर्ट आपको और मजबूत बनाता है एंड इट रियली फिल्स यू विद होप. दूसरा एक और चीज़ जो मुझे बहुत हेल्प की, दैट आई वाज ऑलवेज स्पिरिचुअली इंक्लाइंड, और मेरे फ्रेंड्स फ्रॉम अ बुद्धिस्ट स्पिरिचुअल ग्रुप विच आई एम पार्ट ऑफ, दे एनकरेज्ड मी. They really encouraged me. जब भी मैं अगर कभी थोड़ा लो फील किया, so they used to come to me, they used to come to my house, we used to chant together. There's a lot of reading materials, which gives you a lot of, एक अलग ही thought process बनता है. आपको वो प्रॉब्लम नहीं लगती है, सिर्फ एक सिचुएशन लगती है. सो मुझे स्पिरिचुअलिटी ने बहुत हेल्प किया, मेरी फैमिली ने, फ्रेंड्स ने, मेरे 2 बेटे हैं दोनों ने. सो ओवरऑल आई थिंक बहुत इम्पॉर्टेंट है कि एक पॉजिटिव एटीट्यूड रखें, अपने घर में रखें, अपने अंदर एक हमेशा एक फेथ रखें कि कोई भी सिचुएशन है, चाहे कितनी एडवर्स सिचुएशन है, मैं उससे ऊपर आ सकती हूँ. बहुत छोटी सी सिचुएशन है, आई कैन फाइट दैट.
Very true, very true. So actually what rightly said, that it is the faith, it is the determination. And friends, cancer cannot be fought alone. अकेली लड़ाई मत लड़िए कैंसर की. Cancer is a team game and कैंसर इज नॉट अ पनिशमेंट. आप लोगों को कोई पनिशमेंट नहीं मिला है व्हेन यू से कि हमको कैंसर हो गया, हमको किसी को नहीं बताना है. ऐसा कुछ नहीं है. कैंसर को आप एक एग्जाम की तरह लीजिए और ये विश्वास रखिए कि वो ऊपर वाला आपको अगर एग्जाम दे रहा है तो वो जानता है कि आप इसमें पास होंगे. So even I had a tremendous faith and tremendous support from my husband, my kids, my family. My sister came from US, my parents, absolutely everyone right there, my in-laws, everybody was standing right there supporting. मेरे कीमो में मेरे हस्बैंड, मेरे फ्रेंड्स, मेरे फादर इन लॉ, माई फादर, एवरीबडी. तो एक्चुअली जसलोक में जब मैं कीमो कराने जाती थी तो मुझे पूछते थे वार्ड बॉय कि कोई सेलिब्रिटी आया है क्या कीमो कराने के लिए, इतने सारे लोग कैसे आ गए. सो दैट इज इट, टीम गेम. अगर आपके पास में टीम नहीं है, हम लोग हैं, हम पूरी टीम है यहाँ पर आप लोगों के साथ सपोर्ट करने के लिए. So please friends, let's unite and let's stand tall against this cancer. And a small request to all dear women, it is very, very important that you start taking your health and your life in your own hand. It is absolutely imperative for a woman to stay healthy and to stay happy. अगर वो चाहती है कि उसकी फैमिली हेल्दी रहे, उसकी फैमिली हैप्पी रहे, you have to stay healthy and you have to stay happy. And with this note, I would really like to thank each and everyone here present today, Dr. Advani, Dr. Harish, Dr. Prashant, Monica ji, Savita ji, for being a part of this. So this is the team, jiske paas team nahi hai, we are readily available. You can follow us on, I have a Facebook page called Smile with Rashmi. You can follow us on that. You can connect with us and we will definitely help you. So on this occasion, I really want to say World Ovarian Cancer Day. Here we come and you're going to lose and we are going to win. Thank you so much.